Welcome, my dear students, to the next class, multiple myeloma. It will definitely cross 2 minutes, but it is worth it. It is a B cell dyscrasia, and it belongs to a group called as plasma cell dyscrasia, means abnormality. And there will be the M protein in electrophoresis. Though proteins are increased, they are defective. Immunoglobulins are defective, therefore, patient can have infections. Flat bones are mostly affected. The names are given over here. And the age is 50 to 60 years. This we shall remember. You will not get it in a patient less than 40 years of age. Bone pain, pathological fractures, lack of sensation, etc. can be there. The urine can be showing a Bence-Jones protein. And look at this cell. It is a plasma blast. Eccentric nucleus, a pinkish cytoplasm, and there are also eosinophilic inclusions in the nucleus, the cytoplasm called as Russell bodies. The blood picture. RBCs are normal, normocytic, normochromic, but classical will be the roulette formation. They are all arranged in a row or a stack of points. And the background is somewhat bluish because of the protein precipitation. ESR is markedly increased, 100 to 150 millimeters per hour. Normally, it will be about 7 to 15 millimeters only. Apart from that, you will be finding the Bence-Jones protein, which I will be demonstrating. Radiologically, there can be very well punched out lesions because of bone destructions, and pathological fractures can be seen. And for the sake of recollection, I would like you people to kindly memorize this. The classical plasma cell, myeloma cell, Russell bodies, douches, mulberry or grape cells, Mott cells, and the flame cells. These are important. See what is happening over here. This is almost like a classical plasma cell. It is a oval or a ovoid cell, eccentric nucleus. The chromatin will be in a cartwheel pattern. There is a perinuclear halo. That is C. The immature counterpart is called the plasma blast. All the other series can be suppressed. Definitely by heart this and you shall pass your exam. Look at this. The cells are immature. They have got a clumped chromatin, and some of the cells can be having two nuclei, binucleation. It can be present. So the cells may be mature or immature, large and oval, eccentric nucleus, cartwheel chromatin not seen in a case of myeloma, mynucleate cells, flame cells can be present, Russell, Mott, and Duchess bodies. These are some inclusions which are seen. Look at this one, intranuclear inclusions called as Duchess bodies. And this cell has got a vacuolated appearance called as a mulberry cell or a grape-like cell. And look at the flat bones which are involved. They are having osteolytic lesions which are present. That is also seen. This is called a classical punched out lesion in the skull, and this is an autopsy specimen of the same. Remember this or this, punched out. The blood chemistry, you find that there will be the Bence-Jones protein. This is the Bence-Jones protein. The urine is collected. On heating up to heat 60 degrees, there is a precipitate compared. On further heating, it disappears, and on cooling, it reappears. That is the Bence-Jones protein. Test for BJP. And radiologically, there will be osteolytic lesions. These cells we are supposed to recollect. There is the diagnostic criteria, major criteria, and minor criteria. One major and one minor, or three minor criteria are diagnostic. I would like you people to kindly go through this criteria leisurely and by heart. Other organ changes. In the kidney, I can see the precipitation of the protein, TAM phosphoprotein, the Bence-Jones protein. Another important feature will be the deposition of amyloid. And this is an electrophoresis which is showing the protein separation, and this is the M protein that is getting separated. And in this one, there can be two, either the kappa or the lambda. In this case, the kappa chain is increased and separated. What are all the other changes you can get? Lytic lesions, infection, fractures, renal failure, proteinuria, we have already mentioned, Raynaud's phenomenon, purpura, gamma glomerulopathy, and anemia. So the features are again mentioned for your benefit. And this is the M protein that is getting precipitated. There are other plasma cell dyscrasias. One is MGUS, smoldering, and then the myeloma. There is something called as Poem syndrome. It is a manifestation of plasma cell dyscrasia. Polyneuropathy, organomegaly, endocrinopathy, monoclonal gammopathy, and skin changes such as hyperpigmentation. Monoclonal gammopathy of unknown significance is one. Another is small ring, it is going towards a myeloma. So the count is less than 10%, 10 to 30%, more than 30% in the bone marrow. And similarly, you find that the M component is increased. Kappa and lambda chains are also found increased in this. So myeloma is the most aggressive of all this, and this is most benign. Thank you.